Every myeloma patient is a bit different. We don't actually understand why patients with myeloma are different. When we think of the types of myeloma, we can think of it really in two ways. One is a chemical way, where there's different proteins that are being produced, and every patient produces a slightly different protein. And so some patients produce a protein which is called an IgG, or an IgA, or an IgD. Others form what are called light chains. Now that really functionally makes not a lot of difference. It's more about what those proteins do. They can affect the patient quite differently. So for example, sometimes the myeloma effect on the patient is just because there are just too many plasma cells growing in the bone marrow, and the patients have lower blood counts or a lower immune system. Sometimes the plasma cells can deposit in the bones and cause fractures, pain, or leaking of the calcium out of the bones, called hypercalcemia. Sometimes it can produce abnormal proteins, such as a protein called amyloidosis, which is relatively rare. So myeloma can present in all sorts of different ways. The most common presentation is the bone disease, where patients present with a fracture or pain or a bad back or an elevation of their blood calcium. But sometimes it can cause problems with the protein itself and cause kidney problems and kidney failure. Why it affects one particular patient in one way and why it affects another patient, we don't fully understand that, but it can vary over time. So every patient really is different in their own way.